Bloating on Zepbound or Wegovy is usually not a food problem. It is more often a stomach mechanics problem. Most people keep chasing the wrong ingredients for months and miss the real cause entirely. The real issue is slower stomach emptying combined with how much, how fast, and when you eat. Most people spend months looking in the wrong direction. They eliminate foods, carefully track every ingredient, and still feel exactly the same. On these medications, pressure builds steadily because food enters the stomach faster than the stomach can clear it. That pressure is exactly what makes you feel tight, gassy, or stuck after eating. The issue is usually not one specific ingredient, it is how the stomach is managing the load. I am Dr. Kim, a licensed physician. This is not medical advice, consult your doctor. Now, let us make the mechanism plain. These drugs slow stomach emptying, which means the stomach sends food downstream more slowly. That helps with appetite control, but it also means the stomach has less room for error. A meal that used to feel normal can now feel too large, too fast, or too close to the next snack. That is why bloating often gets worse after a dose increase. The drug effect changes first. Your habits usually do not. Same plate, same speed, same late dinner. Your stomach is suddenly on a slower schedule, but your routine still thinks it is last week. Most doctors focus on the drug. Most patients focus on the food. The stomach is caught in the middle. Most people respond by hunting for one trigger food. Dairy, fat, and fiber all take turns getting blamed. Sometimes one food really is harder to tolerate, but the bigger issue is total load inside a stomach that is already clearing slowly. That is why the fix starts with volume and timing, not the ingredient list. Think about the load. If food stays longer, every next decision matters more. A large portion adds more volume before the previous meal has cleared. Fast eating makes that problem worse because fullness signals arrive too late to help. And grazing all day removes the stomach's only chance to recover between meals. A late dinner then makes the whole system feel even more crowded. The result is not one bad meal, it is a pattern that builds up quietly, all day long. Focus less on finding the one evil food. Focus more on volume, pace, and spacing. Most people skip all three at once and wonder why nothing changes. Smaller portions reduce pressure and reduce how long each meal sits there. Slower eating gives fullness signals time to catch up before you eat more than your stomach can handle. More time between meals lets the stomach clear before the next load arrives. Reduce the number of things working against you instead of compiling a perfect list of forbidden foods. Start with the easiest change and build from there. But there is one more layer most people never think about, and it keeps symptoms going even after they fix the obvious things. The drug is not working alone. The list of contributing factors is longer than most people expect. Constipation, dehydration, low activity, and carbonation can all make bloating much worse, and most people never connect these dots, so they end up blaming the injection alone. These factors do not act separately, they stack. Let us go through each one, because the combination is what makes this so easy to miss. Constipation matters because slow movement farther down the gut can cause pressure to build up behind it. If things are not moving well in the intestines, the whole system feels heavier. That does not mean food is literally traveling backward. It means the gut is moving poorly as a system, and pressure becomes harder to relieve. Dehydration makes it worse in a different way. Less fluid can make stool harder and slower to pass. Then people eat less during the day because they already feel bloated. Then they get too hungry later and eat one bigger dinner. That dinner sits there longer, and the worst symptoms show up at night. Low activity works against the gut in its own way. Movement helps the gut move. A very inactive day can make a slow system even slower. This is why some people say breakfast was fine, lunch was manageable, and dinner felt like a brick. The whole day quietly built toward that ending. Carbonation adds one more layer on top. Gas adds volume, volume adds pressure, and pressure adds discomfort. Sparkling water is not dangerous for most people, But if you already feel stretched, adding bubbles to a crowded stomach is not a clever experiment. Your abdomen rarely responds with gratitude. Now we move to what actually matters. Think like an engineer, not a food detective. The goal is to reduce the pressure your stomach has to deal with while your body adapts. Food composition still matters, just not in the way people hope. Very high-fat meals can linger longer. Very large raw vegetable meals can feel bulky because a slower stomach struggles with volume and fiber at the same time. Even foods that are technically healthy can be harder to process when gastric emptying is already slowed. On these drugs, the right meal is often the meal your stomach can handle today. It is not the meal that wins a nutrition purity contest. If bloating is mild and linked to bigger meals, routine adjustment should come before alarm. Improvement after changing portion size, pace, or spacing supports that idea. The problem is mechanics, not the food itself. If symptoms reliably worsen after every dose increase, talk with your prescriber about staying longer at one dose. Faster progress on paper is not always better progress in real life. The simplest way to test this yourself is comparison, not guesswork. Try 2 different dinners on different nights. One is smaller and slower, the other larger and faster. Keep the food similar. That way, you are changing only the load and the pace, nothing else. If symptoms change sharply, the issue is probably not a mysterious intolerance. It is load, pacing, and timing. That one test tells you more than a month of food journaling. Some people figure this out earlier than others. If you already had reflux, chronic constipation, or a sensitive stomach, the same dose may feel harsher. It hits differently than it does for someone starting from a clean baseline. This is where judgment matters most. Mild bloating after meals can happen with these drugs. Belching can happen. Feeling very full can happen. But repeated vomiting, severe abdominal pain, or not being able to keep fluids down are different. Those are reasons to contact your clinician promptly, not reasons to push through. And if the pattern changes from annoying to persistent or painful, do not try to outstubborn your stomach. That contest has no trophy. Early action is smarter than delayed regret, especially if you are falling behind on fluids. Here is the bottom line. Bloating on these drugs is usually not about one bad food. It is the result of slower stomach emptying, combined with how you eat, how your gut moves, and pressure from things like carbonation. Change the pattern, and the symptom often becomes much more manageable. You are not developing a new food sensitivity. You are running on a different schedule now. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.